have here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. Okay, so what I want you to notice is that it's not parallel, it's parallel to the fifth metatarsal, but it's not perfectly aligned to the base of the foot. So at this point, I'm going to ask my patient to push her toes toward the floor for plantar flexion. I'm going to make sure that that movement is still parallel but not lined up. Make sure my fulcrum and my stationary arm are in place. And then I'm going to lift the goniometer off so that I can see a little bit closer. And I'm going to tell you that she is roughly at about 50 degrees, okay? And for plantar flexion, we look for 45 to 55 degrees. Okay, so we're measuring again dorsiflexion, and we line the fulcrum or the axis up at the lateral malleoli, and the stationary arm along the lateral aspect of the fibula, using the head of the fibula as a point of reference. But it gets a little tricky because of the way that the foot is shaped. So it's very important that you start your goniometer at 0, but in the 90-degree plane. So it's almost important to actually have your patient come to a 90-degree angle by making your movable arm parallel with the fifth metatarsal. So at this point, what I'm going to do is I have her aligned. Now I'm going to ask her to raise her toes toward the ceiling. And then I follow that still in a parallel fashion. And that's where I pinch the goniometer and relax.